Part 2. In this section, we'll explore the best available evidence for the treatment of acute appendicitis, appraise a high-quality randomized trial, and reflect on how your care in China compares with contemporary practice in evidence-based healthcare. The APPAC trial by Salminen et al. 2015, published in a JAMA, is our highest level evidence for treating uncomplicated appendicitis. It's a level 2 multi-center randomized controlled trial that enrolled over 500 adults with CT-confirmed uncomplicated appendicitis. Participants were randomly assigned to either antibiotics, intravenous ertapenem, 1 gram daily for 3 days, followed by a 7-day course of oral levofloxacin and metronidazole, or surgery, standard laparoscopic appendectomy performed by general surgeons. This study used concealed allocation. The groups were matched at baseline, and follow-up exceeded 90% at 1 and 5 years. An intention-to-treat analysis was used, adding to the study's reliability. The key outcome was treatment success, meaning no need for surgery. At 1 year, 73% of patients in the antibiotic group did not require an operation. The 95% confidence interval ranged from 68% to 77%, indicating a precise estimate. Here's a visual representation of that outcome. This shows that most patients can avoid surgery initially with antibiotics, although roughly 1 in 4 will still need surgery later. While the trial was open label, outcome assessment was blinded where possible, and robust design makes this a key study in shifting treatment paradigms. The antibiotic regimen was delivered by hospital physicians with inpatient monitoring for the IV phase and close follow-up after discharge. Highlighting these options still requires coordinated care and informed patient consent. Your care in China in the 1990s reflected the standard of that time. Surgery was the immediate treatment of choice. Imaging was limited, and follow-up options were variable, making a non-operative pathway difficult to monitor safely. You received timely surgical interventions and recovered without complications. That outcome speaks to the strength of decisive care, even if options were fewer at the time. From diagnosis to recovery, your pathway aligned well with what we call early intervention in evidence-based practice. But today, thanks to trials like the APPAC, we now recognize that antibiotics are a legitimate first-line option for some patients, especially for those with low-risk, uncomplicated appendicitis. Your migration to Australia and your role as a nurse specialist gives you a unique perspective. You now work in a system that promotes shared decision-making, multilingual health education, and values culturally responsive care. Yet, we know that CALD patients often face additional barriers, language differences, health literacy gaps, or culturally ingrained trust in surgical solutions. While the APPAC trial was conducted in Finland, its findings remain useful here if we explain them well. That's where you come in. You bridge clinical knowledge with cultural empathy, helping patients navigate the risks, benefits, and personal values that shape their choices. By sharing your experience and integrating the latest evidence, you are empowering others to make decisions that are not just medically sound, but personally meaningful.